I
Thank you for
first
having
want to
me.
start, pleasure, sir. I want to start by understanding, we're talking on day 9 since the first incident was reported here. We've seen, I just laid out the list of actions which have been taken so far. We are seeing some low-ranking officers arrested, suspended, one doctor arrested. We are looking at some companies being banned, some pharmaceutical, one in fact being picked up and arrested as well. We are also looking at a blame game of sorts between center and state on who's responsible. In your opinion, where does the buck stop in a case like this? Who is responsible for all these deaths that we've seen so far related to cough syrups?
Thank you for asking me that question. That's a very pertinent question. And the facts in this case, in fact, highlight very well the convoluted structure of drug regulation in India, because the tragedy has taken place in Madhya Pradesh, but the cough syrups were manufactured in Tamil Nadu. Now, the way Indian law is structured, the central government only sets standards for quality, and they take care of imports and the approval of new drugs, that is, validation of safety and efficacy of drugs. But the manufacturing license, which is the crucial component of quality control, is issued by individual state drug controllers, which means that the quality of drugs manufactured in India can vary widely across states. There are states who are better equipped laboratories, they have better resources generally because they're doing, they have better budgets. So those states may have better drug quality control. Whereas a lot of states where India's drugs are actually manufactured, like Himachal Pradesh and Uttarakhand, have very weak drug control, local state drug control regulators. And this is the complexity, the heart of the problem in Indian drug regulation. You have one market for drugs, that is a drug manufactured in Himachal Pradesh can easily be sold across the country. But when it comes to regulation, you have this fragmented system of regulation where you have regulators, each state regulator and each union territory regulator looking at their own issues. So there are a lot of cracks in the system and a lot of stuff falls through because there isn't enough information sharing between different state drug controllers. For example, something as simple as having a centralized database. We don't have that. You want to check inspection reports, you want to check drug samples which have failed in government labs. There isn't a centralized laboratory. You can't find it.
Yeah. In your book that you wrote back in 22, you have argued that India's regulation on drugs is not just flawed, it's opaque, and it's also under-resourced. So are we to understand from this that this is not just a problem of implementation, but this is a problem of regulation as well? We need stricter laws and perhaps an overhauling of who is putting the guardrails when it gets to ensuring that bad medicines, contaminated, spurious, etc., are not entering the markets?
Yes, exactly. I mean, a lot of times after these tragedies, the focus is on issues like corruption and lack of, say, drug inspectors. But the argument that we were trying to make in that book, and which still stands true today, is that we have a problem with the way the system is designed. It is outdated. It was designed in 1940, where the concepts of quality control and regulation were very, very different from what we have today. And there have been attempts by the government to try and overhaul this law. For example, in 2017 or 18, I think when Mr. Jaitley was still a cabinet minister and alive, he was the one who had pushed for the government to enact a new law, because what they were otherwise doing was they were putting band-aids on this old 1940s law. So in 2022, they did introduce a new bill, which was very badly drafted. It was basically a copy of the old bill. There was a lot of opposition to that. And after that, the government just dropped the ball. The need of the hour today is we need to overhaul the entire regulatory framework for drugs and to some extent nutraceuticals and design a new system, keeping in mind the federal structure of the country and the health needs of the Indian people.
You talk about the bill, but there was a revision, right? The Jan Vishwas bill that has been brought in by the government. What do you make of that?
Yeah, the Jan Vishwas bill was a very, very bad idea. It was it amended only one provision of the Drugs and Cosmetics Act. Basically, it decriminalized the manufacture of substandard drugs, which basically means if a drug fails to meet quality specifications regarding the active ingredient that it has, it fails to dissolve, or if it fails a sterility test, the law used to mandate imprisonment of 2 years and a fine of 20,000. So the Jan Vishwas bill basically said that we will make it a compoundable offense, for the first offense. That is, the first time you can get away by just paying a fine of 20,000 without having to face any criminal consequences in terms of imprisonment, which was a very bad idea. I mean, we need to be regulating the industry more, not less. But yeah, unfortunately, that law was passed by Parliament in 2022.
Right. I just want to get an understanding from you beyond just the present case of cough syrups. And we looked at some data, some of which has been pointed out in your book as well. 2020, in Jammu and Kashmir, I believe 11 children had died, again that time due to cough syrups. In 2022, we had the Gambia tragedy where 66 children had died. Uzbekistan also happened in 2022. In 2024, we dug up some data to find out that in the state of Karnataka, women who had just had cesarean operations were given some substandard IV drips that led to some deaths as well. Where I'm getting with all this data is the fact that in 2020, the company was in Himachal. In 22, the companies were in Noida and Haryana. In 24, it was a company called Paschim Banga. Now, in 2025, we're looking at companies based out of Tamil Nadu and other places. This is not just a particular state problem. We are looking at a systemic failure to keep a check on what enters the market. Is that correct?
Yes, that's very true. There's a systemic failure across the country. There needs to be a complete overhaul. And that overhaul is very, very difficult because the pharma industry at the state level is deeply enmeshed in state politics. You've got political parties, local politicians with stakes in pharma companies. They get funded by pharma industries, especially the small and medium sector, which is the most influential. So any attempt to try and reform this will require political parties to take this up at a national level. And we're unlikely to see that, unfortunately, because even after these tragedies are happening, if you notice, political party leaders are not speaking up because everyone's got skeletons in their closet, right? So it's not become a political issue this time. Even when it happened in Gambia, the government just washed its hands off the entire tragedy. And now we are facing the consequences after ignoring the export markets.